There is one vitamin that your body absolutely cannot function without. One vitamin that your brain needs to think clearly, that your heart needs to beat properly, that your bones need to stay strong, that your immune system needs to fight off disease. And right now, without knowing it, millions of seniors are running dangerously low on this single vitamin. Not because they are eating badly, not because they are being careless, but because after the age of 60, your body loses its ability to absorb this vitamin the same way it did when you were younger. And the damage it causes is being mistaken every single day for normal aging. Doctors are calling it tiredness. They are calling it memory fog. They are calling it just getting older. But it is not just getting older. It is a deficiency that is silently destroying the health of seniors across the world. And the tragedy is that it is one of the most easily corrected problems in all of medicine, if you catch it in time. I am Dr. Calara, and welcome to Health Hub, where we give you real, honest medical knowledge to protect yourself and the people you love. Today, I am going to tell you everything you need to know about this deficiency. What it is, what it does to your body, how to recognize it in yourself or in a parent or grandparent, and exactly what to do to reverse it. Please stay with me all the way to the end because the information in this video could genuinely change your quality of life or save the life of someone you care about. And if you are not subscribed yet, please subscribe right now so you never miss videos like this one. The vitamin I am talking about is vitamin B12. And before you think you already know about this one, before you think this is something you have heard before and it does not apply to you, I want to ask you to stay open. Because what most people know about B12 is only the surface, the real depth of what B12 deficiency does to the aging body, the full picture of destruction it causes when it goes undetected and untreated for years, is something that genuinely shocks people when they hear it for the first time. And it is something that every person over the age of 55 needs to understand. Let me start by explaining what vitamin B12 actually does inside your body, because it is involved in so many critical functions that it is almost hard to believe one single vitamin could matter this much. B12 is essential for the production of red blood cells. Without adequate B12, your body cannot produce healthy red blood cells, and you develop a specific type of anemia where the red blood cells become abnormally large and ineffective at carrying oxygen. Every cell in your body, every organ, every tissue needs oxygen to function. When oxygen delivery is compromised, everything suffers. B12 is also absolutely critical for the health and maintenance of your nervous system.
There is a protective covering around every neurofiber in your body called the myelin sheath. Think of it as the insulation around an electrical wire. Myelin allows neurosignals to travel quickly and accurately from your brain to every part of your body and back again. Vitamin B12 is one of the essential building blocks required to maintain and repair that myelin. When B12 is deficient, the myelin sheath begins to deteriorate. Neurosignals slow down. They become inaccurate. And in severe cases, the neurons themselves begin to die. This process is called subacute combined degeneration of the spinal cord, and it is one of the most serious neurological complications of B12 deficiency. B12 is also essential for DNA synthesis, which means every time any cell in your body needs to divide and replicate, B12 must be present. B12 works alongside folate to regulate a molecule called homocysteine. When B12 levels are low, homocysteine levels rise in the blood, and elevated homocysteine is one of the strongest known risk factors for heart disease, stroke, and dementia. B12 supports the production of serotonin and dopamine, the neurotransmitters that regulate your mood, your motivation, and your ability to experience pleasure and calm. And B12 supports cognitive function at every level, from basic concentration and memory recall to complex reasoning and problem solving. When you lay all of that out, you begin to understand why B12 deficiency in seniors is so devastating. It does not just cause one problem. It unravels health from multiple directions simultaneously. The heart, the brain, the nervous system, the blood, the mood, the energy, the immune system. All of them depend on this one vitamin. And all of them suffer when it runs low. Now here is the part that is truly alarming. After the age of 50 and increasingly after 60 and 70, the human body loses its ability to absorb B12 from food efficiently. This is not about diet. A senior who eats meat, fish, eggs, and dairy every single day can still become severely B12 deficient. Here is why. B12 from food needs to be separated from the proteins it is bound to before the body can absorb it. This separation requires stomach acid. As we age, the stomach produces less and less acid, a condition called, which is extremely common in older adults. Without sufficient stomach acid, the B12 in food stays bound and cannot be absorbed. Then there is a second step. Even after B12 is freed from food protein, it needs to bind with a special molecule produced by the stomach lining called intrinsic factor before it can be absorbed in the small intestine. Many older adults develop a condition where the stomach produces insufficient intrinsic factor, either due to changes in the stomach lining or due to an autoimmune condition called pernicious anemia where the immune system actually attacks and destroys the cells that make intrinsic factor. Without intrinsic factor, even a high dietary intake of B12 will not be absorbed properly. On top of this, many of the medications that seniors take most commonly directly interfere with B12 absorption. Metformin, which is one of the most widely prescribed medications in the world for blood sugar control, is known to reduce B12 absorption significantly with use. Proton pump inhibitors and H2 blockers, the medications taken for acid reflux and stomach ulcers, reduce stomach acid, which as I just explained is required for B12 absorption from food. Antacids taken regularly have the same effect.
Research shows that people who have been taking these medications for more than 2 years have a substantially higher risk of B12 deficiency, and yet many of them have never had their B12 levels tested. The result of all these factors combined is that B12 deficiency is extraordinarily common in older adults. Studies estimate that between 10 and 30% of adults over the age of 60 have low or borderline low B12 levels. Some research puts the number even higher when more sensitive testing methods are used. And the majority of these people do not know it, because the symptoms of B12 deficiency look almost identical to what society tells seniors to expect as a normal part of aging. Let me walk you through the symptoms now, because this is where I want you to be very honest with yourself and very attentive to anyone over 60 in your life. The first and most common symptom of B12 deficiency is fatigue. Not just regular tiredness at the end of a long day, a deep, persistent, bone-level exhaustion that is present even after a full night of sleep. Seniors with B12 deficiency often describe waking up tired. They describe needing to rest after very minor activity. They describe a heaviness and lack of energy that they have simply accepted as part of being old. But this exhaustion is often not age. It is oxygen starvation at the cellular level caused by the anemia that B12 deficiency produces. The second symptom is weakness, a generalized muscle weakness that affects the arms and legs and makes activities that used to be easy feel difficult or impossible. Carrying groceries, climbing stairs, rising from a chair, these everyday actions become effortful and sometimes painful. This weakness is partly from the anemia and partly from the beginning of nerve damage that impairs the communication between the brain and the muscles. When this weakness is accompanied by difficulty with balance or an unsteady gait, the risk of falls increases substantially. Falls are one of the leading causes of serious injury and death in older adults, and B12 deficiency is a measurable and reversible contributor to fall risk. The third symptom is neurological, and it is one of the most frightening. Tingling or numbness in the hands and feet. This sensation, often described as pins and needles, is caused by the deterioration of the myelin sheath around the peripheral nerves. As I explained earlier, B12 is required to maintain and repair that protective covering. When B12 is low, the myelin breaks down, nerve signals become erratic, and you experience those tingling, buzzing, or numb sensations in the extremities. If this nerve damage is allowed to continue, it can progress to significant weakness, loss of coordination, and, in severe cases, permanent neurological damage that does not fully reverse even after B12 levels are restored. The fourth symptom is cognitive decline. This is the one that causes the most heartbreak because so many families are watching a parent or grandparent struggle with memory problems, confusion, difficulty concentrating, and personality changes, and they have been told it is just dementia or just Alzheimer's, when in some of these cases, it is B12 deficiency causing or contributing to the cognitive symptoms. B12 deficiency causes brain atrophy, meaning the brain literally shrinks in volume when B12 is inadequate for extended periods. It causes white matter lesions in the brain. It elevates homocysteine, which is directly toxic to brain tissue. Multiple studies have found strong associations between low B12 and accelerated cognitive decline and dementia. The reason this is so important is that dementia from Alzheimer's disease, once it has progressed significantly, cannot currently be reversed. But cognitive decline caused or worsened by B12 deficiency can be significantly improved when B12 is restored, especially if it is caught before irreversible structural damage has occurred. I have personally witnessed patients who were referred to me with what appeared to be early dementia, who had confusion, memory lapses, difficulty with word finding, and personality changes, recover meaningfully when their severely low B12 was identified and treated. Not every case improves fully, but some do. And every case that could have been caught sooner and was not represents a preventable tragedy. The fifth symptom is depression and mood changes. B12 is directly involved in the production of serotonin and dopamine, the neurotransmitters that regulate emotional well-being. When B12 is deficient, these neurotransmitters cannot be produced in adequate amounts. The result is a persistent low mood, a loss of interest in activities that used to bring joy, irritability, emotional flatness, and, in some cases, full clinical depression. This depression in seniors is very frequently attributed to life circumstances, to grief, to isolation, to the challenges of aging. And sometimes those are contributing factors, but a significant number of seniors who are struggling with depression are also profoundly B12 deficient and have never been tested. The sixth symptom is a swollen or inflamed tongue, which medically is called glossitis. This one is less well known, but it is a reliable sign. The tongue may appear red and smooth, losing its normal rough texture from the taste buds which atrophy due to the same cellular changes caused by B12 deficiency. The mouth may feel sore. There may be mouth ulcers. Some people describe a burning sensation in the mouth. These oral symptoms are caused by the same mechanism that causes anemia, the inability to produce healthy cells properly, because the cells lining the mouth and tongue are among the fastest dividing cells in the body, and they depend heavily on B12 for proper replication. The seventh symptom is shortness of breath and heart palpitations. When B12 deficiency causes anemia, the blood cannot carry oxygen efficiently. The heart tries to compensate by beating faster. The lungs try to compensate by breathing more rapidly. The result is a sensation of being breathless with minor exertion, feeling the heart racing or fluttering even when resting, and a general sense of cardiovascular strain. In an older adult who already has some degree of cardiovascular disease, this additional burden can be quite serious. The eighth symptom is vision problems. Optic nerve damage from B12 deficiency can cause blurred vision, double vision, and, in severe cases, a condition called optic neuropathy, where vision loss becomes significant. This is less common than the other symptoms, but it does occur, particularly in cases of very prolonged, severe deficiency. Any unexplained changes in vision in a senior should prompt a full medical evaluation that includes B12 testing. The ninth symptom is pale or yellowish skin. The anemia caused by B12 deficiency reduces the red blood cell count, which can make the skin appear pale or washed out. At the same time, the abnormal red blood cells that are produced in B12 deficiency are fragile and break down more easily than normal cells, releasing a yellow pigment called bilirubin into the bloodstream. This can give the skin and whites of the eyes a slightly yellow tint. This is different from and less intense than the jaundice caused by liver disease, but it is a recognizable sign when you know what to look for. The 10th symptom is difficulty walking and problems with balance and coordination. This is perhaps the most physically dangerous symptom for seniors because of the fall risk it creates. B12 deficiency damages the spinal cord in a specific pattern that affects the tracts responsible for coordinating movement and maintaining position sense. This means the brain loses some of its ability to know where the limbs are in space, a sense called proprioception. Without accurate proprioception, walking becomes unsteady. The gait may become wide-based as the body tries to compensate. Climbing stairs becomes risky. Getting up at night to use the bathroom becomes dangerous. If a senior in your life has become noticeably more unsteady on their feet, has had unexplained falls, or seems to be having difficulty with coordination, please make sure their B12 has been tested. Now I want to talk about what you can do. The first step is testing. A standard blood test can measure your B12 level. In most laboratories, the reference range for normal B12 is somewhere between 200 and 900 picograms per milliliter. However, and this is critically important, many neurological symptoms of B12 deficiency can appear at levels that are technically within the normal range, but at the lower end of it. A level of 300 picograms per milliliter might be reported as normal on a lab report, but research suggests that symptoms can occur at levels below 400 in some individuals. If your B12 comes back in the low normal range and you have symptoms, ask your doctor about testing methylmalonic acid and homocysteine, which are more sensitive markers that can confirm functional B12 deficiency even when the basic B12 level looks borderline. If you are confirmed to be B12 deficient, the treatment depends on the cause and the severity. For people who have deficiency due to dietary insufficiency, oral B12 supplements can be effective. However, for seniors with absorption problems due to low stomach acid, reduced intrinsic factor, or pernicious anemia, oral supplements may not be absorbed efficiently. In these cases, B12 injections are the most reliable treatment because they bypass the digestive system entirely and deliver B12 directly into the bloodstream. High-dose sublingual, meaning under the tongue, B12 supplements are another option that can bypass some of the absorption issues because they are absorbed through the mucous membrane of the mouth rather than through the stomach. Your doctor will determine the appropriate form and dose based on your individual situation. What I want you to take away is that if you are diagnosed with B12 deficiency, treatment is straightforward and effective. Do not leave the appointment without a clear treatment plan. Ask specifically how your levels will be monitored over time and when you should expect to see improvement in your symptoms. On the dietary side, the richest food sources of B12 are animal products. Beef liver is extraordinarily high in B12, with a single serving providing many times the daily requirement. Clams and other shellfish are also very high. Fatty fish like salmon, trout, and tuna provide good amounts of B12. Beef and lamb are good sources. Eggs provide moderate amounts, with most of the B12 concentrated in the yolk. Dairy products, including milk, cheese, and yogurt, provide moderate B12. For vegetarians and vegans, nutritional yeast fortified with B12 and B12 fortified plant-based milks are the primary dietary sources, but supplementation is almost always necessary for people who do not consume animal products. However, as I explained earlier, dietary sources alone are often insufficient for seniors, regardless of how nutritious their diet is, because the absorption problem is the bottleneck, not the intake. Even someone eating liver every week may still be deficient if their stomach is not producing enough acid or intrinsic factor to absorb what they are eating. This is why supplementation and injection are so important for many older adults, and why testing is more reliable than assuming dietary intake is adequate. If you take metformin for blood sugar management, or if you take proton pump inhibitors or H2 blockers for acid reflux, please bring up B12 monitoring with your doctor at your next appointment. These medications are beneficial and necessary for many people, and I am not suggesting you stop taking them. But your B12 levels should be monitored regularly while you are on them, and supplementation should be considered proactively rather than waiting for deficiency to develop. Many doctors do not routinely monitor B12 in patients on these medications, so you may need to advocate for this yourself. I want to say something important about the bigger picture here. We live in a time when senior health is too often managed reactively. A problem appears, a symptom is treated, a medication is added. But so much of what seniors experience as decline, the fatigue, the weakness, the memory problems, the depression, the instability, can have underlying correctable causes that are never looked for because everyone assumes it is just aging. B12 deficiency is one of the clearest examples of this. It is common, it is measurable, it is treatable, and it can cause profound suffering if it is missed. I have had patients in their 70s who came to me barely able to walk a block without exhaustion, who were confused and forgetful, who had been told by well-meaning doctors that this was just what getting older looked like. And when we tested their B12 and found it was essentially undetectable, and when we treated them with injections, the transformation over the following months was remarkable. Not everyone recovers fully. The longer the deficiency has been present, the more permanent some of the damage becomes. But the recoveries I have witnessed remind me every time why early detection and treatment matter so much. You deserve to know that your tiredness might not just be aging. You deserve to know that your parents' memory problems might have a correctable component. You deserve to know that the weakness and the tingling and the unsteady walking might be something your doctor can fix. A blood test, a conversation, a prescription. That is all it might take to give back years of quality life that were being silently stolen by a vitamin deficiency. Please share this video with every senior in your life. Share it with your parents and grandparents. Share it with friends who are struggling with fatigue or memory or balance. Share it with anyone who has been told that what they are experiencing is just aging and to learn to live with it. Because for some of them, it is not just aging. And for those people, this information could be the thing that changes everything. Thank you so much for watching all the way through today. If this video helped you in any way, please give it a like because it helps more people find this information who need it. Leave a comment below and tell me if you or someone you love has been affected by B12 deficiency, because your story might help someone else recognize what is happening to them. Subscribe to Dr. Calara Health Hub so you are notified every time we release a new video, because every week we bring you this kind of clear, doctor-backed health education that you can trust and actually use. I am Dr. Calara, and I will see you in the next video. Take care of your health because no one else will do it for you.